Welcome to Taking the Pulse, a healthcare and life sciences podcast. I'm Tina Emerson, along with Maynard Nexon healthcare attorney Lauren DeMoss. Lauren, it's good to be with you.
Thanks so much, Tina. Great to be with you today.
Thanks for being here. Joining us today is Dr. Brannon Traxler. She is the Director of Public Health for the South Carolina Department of Health and Environmental Control, also known as DHEC. And in this capacity, she provides strategic direction for public health in South Carolina, leading more than 2,000 DHEC public health employees. Dr. Traxler, thank you so much for joining us today. We appreciate it. You clearly have a big job before you. And during the pandemic, that included serving as chief medical officer to help oversee South Carolina's COVID-19 response efforts. What was a typical day like during that time?
Very long and often very unpredictable. And thank you all for having me as well. I'm very excited to join you today. Looking back, really that first summer of the pandemic when I was serving in that role, before I took the director of public health position, looking at the calendar, I mean, it was very full, but it also was, as I said, very unpredictable. One of our mottos in our agency coordination center, which served as our emergency operations center, was Semper Gumby. Basically, always be flexible, because there was a new issue, a new crisis, a new fire to put out every day. It was very unpredictable, not just the virus, but every aspect of it. So it was intense. It was very long hours, but it was with the most dedicated team of people statewide. I mean, both internal to DHEC and our external partners that I've ever worked with.
You know, Dr. Traxler, you mentioned being flexible and that being a lesson you learned during the pandemic. What were some of the other things that you think you learned personally, the department learned, and how are they impacting how you all handle things today?
Sure. So I do think that one thing I know I learned, and I think that was emphasized also for the agency, was truly the value of partnerships. And I know I personally created many relationships, with entities I would have never imagined I would be interfacing with, but that I really enjoyed working with, across the state. And the agency also, I think, reinvigorated a lot of its relationships this crisis. One thing that we've taken away from it that I often preach to my leadership team, and I know is important agency-wide, is maintaining these partnerships. We really have to continue to nurture them and grow them during what they call blue sky times in the emergency management world, the non-emergency times, so that they are established and you don't have to build them from the beginning when there is an emergency. I think also the importance of transparency, with the public. Certainly, we were never intended to not be transparent, but I know I learned to be more intentionally transparent as we went along, as well as I think learning about just the different information needs and desires of the public, and really the importance of trying to provide everything we possibly could information-wise during a scary time for people.
And working with those agencies has to be a really big job, particularly in public health. And what I didn't mention earlier in your biography is that you used to be a practicing surgeon. So that was a surprise to me reading that here. Tell me about that transition from being a private practice surgeon to public health.
Sure. And yes, a lot of people don't know that about my background. But I did. I spent 10 years training and practicing as a surgeon before making the transition. And I do think that it prepared me. I do think that there are definitely aspects of it that prepared me, especially for the pandemic, the emergency scenario that we were in. Certainly, I learned to gather and synthesize information and make a decision in sometimes even a split second in the operating room. You don't have time sometimes to really stop and deliberate, and go around and around in circles. You have to make a decision and act on it. And so that certainly, I think, was able to carry over some of the times we had to make quick decisions in the emergency and the pandemic. But I really just had, after being out in private practice for a couple of years, after training for 6-7 years, decided that I really did not feel like I was meeting my mission, taking out one gallbladder or appendix, whatnot at a time. And while that's certainly very important to each individual person, I felt like I could make a bigger impact, more collective impact at a population level. And so went back and got a master's in public health degree 10 years after I finished med school. It's definitely harder to pull an all-nighter studying 10 years later, but then went to work in 2018 when I graduated for DHEC.
Dr. Traxler, you kind of talk about, wanting to make an impact and transitioning into public health and thinking about just kind of the healthcare world in general. And we've talked to previous guests about nursing shortages in healthcare, and that being a real challenge right now. What do you see as future challenges? Do you see there being a shortage of physicians? I mean, I think burnout is very real coming out of COVID. I'm curious kind of what else you all anticipate on the horizon.
Absolutely. And, I think one thing people maybe don't realize is we had a national nursing shortage going into the pandemic. The United States was about 100,000 nurses short of what we really needed prior to 2020. I can remember very early in the pandemic learning about some of the other states that were building temporary hospitals and tents and all. And we started talking about what if we got to a point in South Carolina we had to do that. And I said, y'all, it's not the physical buildings that are the rate limiting step. It's the caregivers. And that is true. I think nurses are where we have seen it the worst, but it is true across the board in healthcare. Everything from pre-hospital medicine, we're seeing shortages of EMTs, paramedics, sometimes as much as 30% below what's needed, all the way up, like you said, to physicians. I think as the baby boomer generation of physicians continues to retire more and more, and are also as that large generation needs more and more healthcare, we are going to see more strains even on physicians and at that level. I think that the American the Association of American Medical Colleges, the AAMC, in the last couple of years, was doing a prediction. And they said that basically we're going to be between like 35 and 125,000 physicians short, by 2035, with a lot of those being primary care physicians, but then another chunk of them being the specialists. So I do think that across the board, healthcare fields, large part it's burnout. There's quite a variety of factors. The pandemic certainly didn't help with a lot of them. We're going to see worsening shortages. And so we're being very deliberate, even in public health, about building the workforce and the pipelines.
And you mentioned the pandemic being the cause of a lot of that burnout. It was also the cause of a lot of advanced technology in the field. The telehealth has ramped up, and a lot of other things have made it to where people can access healthcare a little more readily. What do you see as advanced technologies that have really benefited us, and what do you see in the future in public health and how that will affect it?
Certainly. And so telehealth and a lot of the flexibilities around it, for many areas of medicine, have been a great opportunity, and hopefully will continue to, especially for rural areas, that really can open up the access to healthcare a lot more for them. There's certainly areas of medicine, again, that yielded themselves more to it. It's a little hard to operate, via telehealth, though you can do some robotic surgery remotely. But things like psychiatry, we know that there's a behavioral and mental health crisis really in our country, and thankfully that can be done very easily over telehealth. I think that the private-public partnerships in general that we saw during the pandemic are going to hopefully be a model for many years to come, in the development of devices, pharmaceuticals, the Operation Warp Speed and the development of the vaccines, picking up where really it had kind of just been slowly worked on since 2003, the SARS pandemic or epidemic, really picking that up, and within a year having millions of doses of vaccines was only possible because of the advances not only in technology but in those private-public partnerships working together. And so I hope we see a lot more of that collaboration across all different areas.
And there are a lot of technological resources, but then there are a lot of human resources as well as an agency director. We talked a little bit about earlier the split of DHEC as the Department of Public Health and splitting off the environmental side of that agency. Can you talk a little bit about how that might affect what you do and then how your team is going to be flexible in that way?
Absolutely. And so the bottom line is it's not going to affect us a whole lot, in the sense of we're still going to be looking out for the health of the people of South Carolina, regardless of what we're called or how we're structured. And so for the vast majority of our employees, it's just reassuring them that their work is going to continue, that there may be changes for them, but they will be things like the logo and name of the organization on their badge. I want to make sure that our staff knows that we're watching out for them. And while there are changes going on, we don't want to lose a lot of them because the work is going to continue. And I hope we'll come out even better as we go through this process, that we will be even more efficient, but also just have smoother processes and better outcomes, because we are still just as committed, if not more so, to protecting and promoting the health of everyone in the state.
So as we wrap up, Dr. Traxler, and you think about kind of the last couple years and what all you've accomplished and the agency's accomplished, what do you kind of see as your big wins or your bragging points? And then maybe, on top of that, the challenges that have come out of that?
Certainly. And so I think that the biggest challenge that that I have faced, that I think is also then one of my most proud parts of the outcomes, has been our team. And that doesn't mean that we didn't lose some people, that some people didn't go to other opportunities, but we have seen a significant reduction in the public health workforce and the healthcare workforce over the last few years of the pandemic. And I think that we have been very deliberate at DHEC, led by our agency director, at watching out for staff, helping to protect each other, and be there for each other. And so that is something I have taken very seriously. I think that we got through all of this because we looked out for each other and we were really a family at times. And so therefore I'm very pleased with coming out the other side. We do have work to do, certainly still with our workforce, and we put that team through a lot over the last few years. And so I'm committed to continuing to watch out for them and also give them some time and space as needed to heal from the last few years and recover. But I think coming out the other side, the individuals and as a group, is really what I'm most proud of, how we came together and got through it together.
Well, that is a perfect way to end it. We always like to end on a high note, and that certainly is one. Thank you, Dr. Traxler, for being with us and for everything that you've done for the state of South Carolina. Going through the pandemic is no small feat, particularly for an agency like yours. So thank you for being here with us.
Thank you. Thank you again for having me.
We'll see you next time on Taking the Pulse.